Hi everyone, my name is Dr. Raja Adnan Ahmed and I'm a psychiatrist. I work in UK. This presentation is specifically for the international medical graduates who wants to come and work in UK and they asked me about how to write their medical CV. So this is not about how do you develop your CV. There's a different video for that where I talk about what kind of things you can do to improve your skills level. This is about the format of a CV when you're actually trying to put your information on a format in a CV format. What sort of things should be included and what sort of things people will look out for. Please remember a few things. When we are actually applying for jobs in UK, we do not usually send our CVs out. We normally apply via the NHS jobs or track jobs like website. But sometimes when people are applying for things like clinical attachment, they might need to send their CV as well. And on some occasions, when you're applying for job via track or NHS jobs, they will also ask you to include your CV. For that, this will be useful. The other thing to also mention and remember is that please do not lie on your CV because that's a very unethical thing to do. And if you are caught, you will have that will have severe consequences as well. Also, I like to mention that the format I will show you is the format I have been using for myself for the last 15, 16 years. But this is not the only format the CV is written. So there are other formats available. So if you find something else which you think is more appropriate for your CV, please use that. This is not the only thing that should be used. So let us start the presentation. I'll show you in real time how a CV should be written. So this is a very simple example of a CV which I've made on Word documents. And remember, when IMGs are sending CV, sometimes they're making some mistakes. Like, for example, they will send such a long CV that the person who likes to read it, even then they will get lost within the information available on that CV. So ideally, I like to encourage people to try and make CV, which is only for maximum of 3 to 4 pages. I mean, I'm working as a consultant now, and my CV is not more than 4 pages. So you can understand, when you are trying to give your information to somebody else, it needs to be easy read and it needs to be relevant as well. So let us start off what section should be included in the CV. And as you can see on the screen, the first section I would recommend is your personal information. You can write your full name, your date of birth, work address, email address, and mobile number. Email address and mobile number. So if they want to contact you, they can do that. Work address, if you have a recent work address, you can write that. If you're not working, you can skip that as well. Some people like to write their date of birth, some will not write their date of birth. Sometimes they will only write the age, but that is not essential. Again, if you want to miss the date of birth or age, that should be also be fine. The things I do not include are here. I don't include my home address. I don't include sex, my father's name, husband's name. I've seen a lot of people including that passport number, NIC number, if you're married or not. This information is not really important. And this is personal information. When you're sharing with somebody, when you're sharing your CV around, you don't want everybody to know where you live, and all your personal information. So there's no need to include all of that. Some people will also include their photograph. I have never included my photograph on a CV. If you want to do that, it's up to you. But it shouldn't really be one of the focal points of the CV that how do you look like. The next section after the personal information is very important. It's about your professional qualifications. And I've seen a lot of people putting irrelevant information here, like they will put their FSC, A levels, O levels there. But you're going for a doctor's job. The thing which is important is that you have done an MBBS or a medical qualification, and you can put it there at first and along with the name of your university and when did you complete that. And after that, the things you have done after your MBBS are important. If you've done PLAB or any licensing exam, you can put it there. If you've done any masters or any higher qualifications, they can also go in there. If you, for example, are doing MRCP, but you've only done a part of that, you can still put it in here and say that this qualification is ongoing and you have not yet completed that. The next section is certification and registration. This is again important because this is where you are telling them that you have GMC registration or registration of your own medical council or any other registration which are available. So it is important to put, for example, if you have GMC registration, that you have full registration with license to practice, your registration number, and since when your registration has been active. This information will be helpful for them to know that you are ready to take up a job and you are the right candidate. This will normally fill up your first page of your CV. The thing which is important afterwards is your current position. That what are you doing currently at present? So a lot of people will say that actually I am not doing anything currently. I am on leave or I am on a gap year. So you can put your last job which you have done in medical setting, or if you are doing a job which is not as a doctor's job but as sort of some people do other jobs like a healthcare assistant, things like that. You can, if you like to put that, that will also be relevant. If you've done a clinical attachment, you can also put it there as well. So like for current position, if you're putting it, it's important to tell them what is your current position, what is your role, what is the specialty you're working in, name of the hospital, country of the hospital, and since when you started this post and how long it's going to be. If you don't have end date, you can just put date, which means that it is relevant at the time you are submitting the CV, or if there's an end date, you can put there as well. Now, always write a little bit about the roles and responsibility in the current position or the last position you worked in. And this is important for you to tell them that you have the skills required to take up the post you're applying for. So, for example, I've written here that this person, hypothetical person who is applying for a job in psychiatry, they have done a psychiatry role in middle grade level, and they have done ward work, they have done outpatient clinic, they have also done supervision of the junior doctors and all of that. So this section is important because here you can put, you can understand, try and understand the job you're applying for, the job role, and if those things you have already done in your life or you're already doing in your current role, put it there, because then the person reading the CV would know that you are the right person because you have the skills already. After that, we can go to the past appointments. And if you're looking for past appointments, I would say that the last 3 or 4 jobs will be very, very important. Some people have very long CV. So if they've been working for the last 10 years, they say, well, my past appointments are very, very long. So you just need to put the last 3 or 4 years, which will be more important. So for example, if you're going for a specialist job, they don't like to know what did you do as a house officer. They like to know that what was your specialist training like. So that would become a more relevant part. But here I'm just showing you an example because a lot of people who are applying junior doctors, they have just done house jobs. So how do you put your house job experience here? You can just write your house job internship, foundation year, equivalent experience. You can you can say whatever your job role was and the specialty you were working in, the name of the hospital, city and country, and the dates you were a house officer. Some people get confused. They say that they have done several rotations during a house job. Should they put all of them? Should just put few of them? If they're relevant, if you think this will make your CV look good, if this is relevant to the job you're applying for, then definitely you should mention that. So, for example, sometimes psychiatry rotation are in the house job, but they are part of another rotation. You may only spend 6 weeks in psychiatry, but if you're applying for a psychiatry job, then mention that here. That will be useful. And like that, you can create a timeline of your jobs you have done so far. You don't need to mention any gaps here, because that is something that will become obvious. That if there are any gaps, you don't need to specifically write that there was a gap in between these 2 jobs. I think these 3 sections which I've just talked about are important, and this is how I will always put my CV. So I will first write the personal information, the professional qualifications, certifications, and then the current position along with the past appointments. After that, what I will talk about, this is something you can change according to your CV and according to the job you're applying for. So the things I will talk about, the things we normally put in CV are teaching experience, research experience, audit and quality improvement experience, management experience, conferences and courses attended, and skills acquired. Now, this can be moved up and down. I don't want you to think that this is the only format you can follow in. If you're applying for an academic job, which includes teaching and which include academic work, I would say that to put these sections first, the teaching section and the research section. But if you're applying for a job which is more clinical, you can put these sections first as well. So when you are putting your teaching experience, you don't need to have that. Some people are more keen to teach, some people are not so keen to teach. But this section is for qualification experience related to your experience to teach. If you've done a postgraduate certificate in medical education, this is the time to mention that. You can mention it here as well, and also you can mention it here if in your professional qualifications. If you have done any courses related to teaching, you can mention it there, and then you can mention your experience of how do you, where have you used those skills. So if you are teaching medical school students and junior doctors, you can mention that here, and then you can write a few lines that you have involved in something to do with the medical student, because that will make it look good. It's not just you are mentioning that you're teaching medical student, but you're actually giving a few lines of what is your role exactly in that. The next section is about research. I think this is easier. I normally put my research and posters with the same section because they are kind of similar things. You can list any research you have done and any posters you have done and any courses sometimes you can also put as well. So for example, I've mentioned here, if you've attended a research scale course, I think this is the right time to mention that as well again, that you have attended that course. So if you are somebody who's got multiple research activities, then you can mention the most common three, the recent one, the ones you are really proud of, the ones you thought will actually make your CV shine. The next section is for audit and quality improvement projects. Now, I understand a lot of international medical graduates wouldn't have done that. And there's nothing to worry about, nothing to be stressed about. If you haven't done that, you can just skip that section completely from your CV. Or if you attended any courses again to do with audit and quality improvement, you can mention that course particularly here, that so they know, although you haven't done an audit, but you have some understanding of audit and quality improvement activities. Now, management and experience to leadership. This is something again which is useful when you're mentioning the CV, when you're writing a CV. You can list your clinical and non-clinical experience of management and to leadership. So, for example, you will find a lot of medical students say that they were during their medical school they were a lead of something. They were a lead on the social events. They were a lead on one of the drives that was happening in their medical school. That could be mentioned here. And if these could be a non-clinical skill as well. For example, if you were a part of a sports team, things like that, that could also be mentioned here. Then I also sometimes include, this section is not essential, but if you have been attending some relevant courses, conferences, and skills that are very specific to that particular job, it's again good to mention them. So for example, if I'm going for a psychiatry job and in the last 2 years or 3 years, I have attended a few psychiatric conferences, I think it will be good to mention that. So the person reading my CV can understand that I'm keeping my knowledge up to date. If I have attended any particular courses, you can either mention the courses in the relevant sections, or you can mention them here. Or if you have particular skills that you think would be relevant for that particular job, that can be also mentioned here. So for example, if I am going for a psychiatry job and I think assessing patients in psychiatric emergencies, assessing them in an outpatient clinic, assessing them as an inpatient, managing complex psychiatric illnesses is a skill worth mentioning. I can actually write those skills here. Following that, you will have a section for the references. Now, this is an important section because in UK, when you're applying for a job, they normally ask for references. Normally, they ask for 2, sometimes 3, sometimes in rare occasions, they can ask for more as well. But when I'm actually writing a CV myself, I will not give the names of references at that point. The reason for that is then when you're writing a name of reference, you're also giving some information about them, like their email address, things like that. You don't want that CV to go around and their information of your senior to be shared like that, unless your senior is happy to be for that to happen. So I will normally write this line only, that references will be given on request, and leave it like that. But if you are putting the names of your references, it's just good to write their name and who they are, their rank, the name of the hospital they work in, the city and the country they work in, and their email address. So if somebody wants to reach them, they can be contacted. Now, again, some of your references will not be happy to give their email addresses out so easily. They might say that actually, don't give my email address out. I don't want to get random emails. People are usually not happy for their phone number to be shared like that. So this is the reason I try and avoid this section. If you can just read it, you can just leave it from at the stage of city and country and not give them email, and give emails. You can also write that email will be given on request. Normally, at the point of references, the CV finishes. But I know some of you will ask me that what about the personal statement and the non-clinical skills? Should they be included in the CV? So non-clinical skills certainly can be included if you think you have some amazing non-clinical skills in terms of computer or in your skill to manage things, and if you've done things outside your outside the area of medical field, you can certainly include that. But I normally include the non-clinical skills along here, because they are mostly to do with you able to manage and lead. So they can be included here rather than making another section for that. Personal statement is something, it's up to you if you like to include that or not. But when you're writing a personal statement, it need to be very clear. If it should be specific to that particular job you're applying for, the specific for the reason you're sending your CV out for. Some doctors I've seen, they just write personal statement, will have a lot of good words, but it will not really have that much of an impact. So you can write it. You can write 4 or 5 lines if you like to write it, but I personally do not include that. I think a person without a personal statement, CV itself should have good weight and should be enough. So thank you very much for listening to me and listening to this presentation. I hope this was helpful, and I will, when I post this on Facebook or I'll post it on YouTube, I will try and post a link for this particular CV as well as in a Word format. So if somebody wants to download it and write it, then they can use it. Again, I like to say that please remember, this is not the only format of the CV. You can always find other formats. You can. This is a very simple format which I've been using myself, and I'm not saying that I'm an expert on CV writing. So you can find some other formats. Have a look at other formats as well. See if they attract you more. Thank you very much.